Whakataka tihau ki ti uru, whakataka tihau ki ti tonga. Kia makina kina ki uta, kia matara tara ki tai, ehie ake ana ki atakura, he tio, he huka, hi hauhu, tehie Maori ora. A very warm welcome to all the participants to our Health and Wellbeing Industry Insight Webinar. I'm Dr. Sadia Faisal and I'm working as Head of School for School of Health and Wellbeing at NZSE. And this NZSE is one of a very prominent uh, tertiary education provider. And we have been delivering different programs, not only related to healthcare, but with IT, ECE, and with our foundation pathways. Today we would be talking more about healthcare, very much focused on healthcare. We are delivering healthcare programs across different campuses. We have campuses in Auckland and in Hamilton, and in Auckland we have campuses in Manukau, Newlyn, and CBD. So especially for those who are new and who are not very familiar with NZSE, just want to give a brief introduction about us. I'm really happy to see all the participants who are here. I know I can see the faces of my current students here as well. At the same time, I have my academic team staff here. Thank you very much for joining. I have Leslie Mehmet. She is here. Thank you very much, Leslie, for joining. She is our recruitment team manager, and I invited her specially so that in case if there are any questions about the recruitment, if there are any questions about the enrollment of the programs, then she would be able to answer. Leslie, it would be good if you can just introduce yourself and say hi to all these participants.
Yes, sure. Thank you, Dr. Sadia. Kia ora koutou, everybody, and welcome to this wonderful webinar that we have tonight. I'm sure that you will all learn something, take away something from the webinar tonight. It's going to be full of knowledge, full of questions maybe that you might want to ask, but it's going to be very interesting. So my role as the recruitment advisor is to enroll learners who want to enroll onto our amazing programs. I'm going to be leaving my contact details in the chat for everybody, so you can see there at the end of this webinar. If you want to get in contact with me, you are most welcome to get my details and contact me. I'll be waiting. Thank you, everyone. Have a lovely evening.
Thank you, Leslie. Before we proceed, I just really quickly want to mention a few of our housekeeping rules. When you joined, you were already muted, and we will keep you muted because we know that at times participants, they forget to mute themselves and there would be background noise, so we don't want to disrupt the meeting. But if you have any question, or if you want to participate, or if you want to say anything, you can raise your hand or you can use the chat feature to indicate that you want to speak. You can see at the top that there is raise hand feature. So you can just click on that and we will unmute you, and we will disable your at your end to let you speak. Second thing is that when you are talking, or when we would be having question answer session later, please have a very professional kind of a behavior. It would be good that you ask the questions respectfully and politely, and avoid any distractions, and respect our speaker. There are chat features there. So please, if you have any questions, you want to provide any feedback, please feel free to mention and type your questions there in the chat. And please have some relevant and constructive communication. This webinar is it has been arranged for you, and we are actually looking forward to have some good engagement and participation from your end. So please do ask question answers, and you can actually raise your hand, or you can use the chat for asking those questions. So I'm hoping that you would have a really engaging and a very insightful session today. Now, apart from that, I would like to mention that if you have any questions about the current programs, about the delivery, then we do have our academic team here, our tutors here, so you can ask questions about how our everyday life is, how our classrooms look like, how we deliver in our classrooms, or online delivery, on-site delivery. So our tutors, they would be able to answer as well. Now moving to Navneet Johnson, I'm really grateful to her for taking out time and be here as our guest speaker. Thank you, Navneet Johnson, for joining us. Before I give mic to her, I just want to mention some of her achievements. She is a registered nurse from India, but she's been here since 2010, and she has worked with some of very big healthcare names, and she has worked in different roles at different designations. We have worked very closely with Nav Johnson for our students' work placements and later on with employments as well. She recently has moved to one of a very major and very big healthcare facility. And I know that from her experience, she would be able to share a lot of information, and she would be able to provide you some good information about that what industry needs, how students should be prepared, and how to look for the employment. So I think her experience, her knowledge, and her expertise would be really helpful for our existing students, for those who are new to NZSE or who are still thinking about healthcare programs. So that's the main reason that we have invited Nav, so that she can actually guide you about healthcare opportunities. And I won't take more time. It's already 7:12. So over to you, Nav, for your discussion. And later on, we will definitely have a question answer session. Thank you.
Kia koto. Good evening. Welcome, everyone. I hope you can all hear me okay. So thank you, Dr. Sadia, for inviting me this evening. Yes, so my name is Nav Johnson, and as Dr. Sadia mentioned, I moved to New Zealand in 2010, started my career in aged care as a very brand new CAP graduated nurse. And over the number of years, 13 to be specific, number of years, I've moved my way up the ladder, starting as RN and going all the way up to the care home manager position in my most recent role. So I wanted to share a little bit about my background. So I have always been surrounded with nurses when I was growing up. We are 5 nurses in my family, my mom, my dad, myself, and both my siblings. So there was no question for me, really. I never thought of doing anything else. I just thought that this is it, and that's what I'm going to do. So yeah, that's a little bit my background. Moving to New Zealand was definitely a big move, professional as well as in my personal life. But to be honest, you know, the amount of love and support that I received in this industry in aged care has been beyond expectation, really. Yeah, so when I look back all those 13 years ago when I started, I never actually thought that I'm going to last there for very long, to be honest, because this was a very new sector to me. But yeah, so I thought I'm going to move on in a couple of years' time. But then here we are, 13 years after, and I just grew in my career and had some achievement over the number of years. So yeah, so that's about me. And yes, I've been asked to share a little bit, expectation and opportunities, really, what's out there in healthcare industry or aged care in specific. So I hope you guys can see those slides. So I've tried to keep it really short and brief. First of all, I would like to talk about the benefits of choosing healthcare. Yeah, so when I say healthcare, I'm focusing on aged care, definitely. As we all have experienced this, and this is not a news to anyone, skill shortage has been number one issue for the past few years, especially during COVID times. We have seen that we lack skill in the industry. There's been, especially locally, we struggle to find staff, and we have worked short staff for many months, if not years so far. So definitely that brings to the next thing, which is definitely there is a great value and recognition of qualification in healthcare. So I'll tell you, when I receive a couple of CVs, for a job applicant as a healthcare assistant or a caregiver, first thing I want to see is what experience do they have, or what qualification they bring with. So definitely those are the two things that we as managers look at. I know there are people who would love to work as a healthcare worker, and they have passion for learning and gaining skills. That's no question asked. We definitely consider those as well. But at the same time, if I see someone comes with a qualification, then I know for sure that they have an understanding of the industry and the role. So yeah. The next one is career progression and better opportunities. So over the number of years, I have met many people who started their career as a healthcare assistant or a caregiver, and they made their way all the way up to either working as RN, clinical manager, care home manager, operational manager, even general manager. Last week, I just met a very young lady, and she has been well established in this big industry, and she started her career as a caregiver. So that was really, I was really thrilled to hear that. So definitely, this is just the beginning. Yeah, if you have a career pathway, you choosing the right step forward. Then job security. So everybody knows, again, being essential worker, this job is very well secure. Many people lost their job, lost their businesses during COVID lockdowns, but this industry is, stayed strong. Of course, we had different challenges with the staffing and whatnot, but, at least we had a job to go to. And of course, last but not the least on this slide is this job is very enjoyable. Once you get to know the residents and you get to know the task and the responsibilities you have, you feel accomplished. End of the day, before you finish your shift and go home, you can literally, tell yourself that you made a difference in someone's life. So it's very accomplishing. So thank you. Now, next one is expectations. So I really wanted to touch base, like, what do you expect when you come to a rest home or a hospital, working as a caregiver, or just for your placement even. So we actually expect all the staff to build relationship and trust with their residents, and vice versa. So you get to know the resident, you get to know the story, you get to know what they like, what they don't like, how they like doing things, because it's all about them. It's all about the residents. And once you get to know them, it becomes easy. Yeah, it becomes a routine. It becomes like a second nature, that what is my resident require. So yeah, that is important, that you have that professional relationship with your residents. Companionship and wellness partners. So I really like this term, wellness partner. In my current job, we don't call our staff as caregivers or healthcare assistant. They are called wellness partners. And I'll tell you a little bit about it. Why this name? I think I was told that because we are the partners in residents' care needs. So it used to be a thinking when we keep resident in the center of everything and we do what we think is best for them. It's different now. We want our residents to choose their goal and decide what and how they want their daily routine to be done. And we become partner with them. Yeah, and we help them, we support them. Then next couple of top bullet points there is about complex needs and different level of care. So residents who come to a residential care facility or a care home are with very complex needs now. They are not the same as it used to be a decade ago. Their needs are much more higher and much more complex. And I'll tell you how. They come with a number of medical conditions, whether it's heart condition, whether it's lung disorder, whether it's cancer, whether it's whatever. Their needs are really complex. So we expect the staff to understand. And that is why, again, hence, having a qualification gives you that platform that you get experience, you get knowledge a little bit. I'm not expecting a doctor to work as a a healthcare assistant, but at least understanding like where do you get information when you need to understand how to look after the resident with these complex needs, or just understanding the terminology really. Then different level of cares. So there are four different level of cares in healthcare or aged care. So I'll tell you a little bit about them. So first one is rest home level of care. So rest home level of care is when a resident, we call them resident, we don't call them patient because they live here. This is their home and we work for them. So they are the resident of the house. So we first of all is rest home level. So rest home level is when a resident requires a little bit of assistance or supervision really, sometimes just a setup for a task such as shower, just help, supervision, bed making. And once the cares are done, then they are good for the day, right? They'll ask you when they need anything. So that's rest home. The next one is hospital level of care. So hospital level of care is when their physical needs are a bit higher, of course, than the rest home. So they would require maybe 1 to 2 staff assist, or maybe up to the mobility transfer aids such as hoists and stuff. So that's hospital level. Then there is dementia level of care or secured level, when the resident's physical needs might not be that higher, but their psychological needs or behavioral support will be higher. So they'll require us to keep them safe, keep them company, be a companion. And the last one is level 4. We call it as psychogeriatric level of care, which is the most high level, and that is when we provide the high level, both physical as well as psychological needs. So that's the 4 level of cares. And as I said before, this is not an institute, it's a community. It's a community because again, the residents live here. So it's not a hospital, it's not an institute. And last is again rewarding and satisfying. So this job is very rewarding when you look after the residents and you help them to achieve their goals. So yeah. Next slide, please. Thank you. Right, so work experience. Now, when I get student at my work, they come for experience. What do I expect from them, or what should they expect from the care home facility or the staff or the resident? First of all, if I can say, just come with open mind. Yeah, do not have very high expectation or set up your mind like this is going to be like this or whatever. Just come with an open mind and take one step at a time. Yeah, get to know the routine, observe, be brave, and ask question. There is no question which is a silly question. You ask the same question over and over again. No one's going to judge you for that. However, if you don't ask the question and you make a mistake because you assumed, then that's a problem. So please ask question. Be a good observer and an active listener. So don't just listen with your ears, listen with your eyes, maintain that eye contact. And that's how you actually hear the story. When someone else is doing cares or providing support to a resident, you observe them. We don't expect us students to be hands-on right away, but at the same time we want them to be observing how things are done. Then again, communication, as I said, keep an open communication, and if you don't understand, you follow up with questions. And same thing, if you're passing any message to anyone, you follow up as well, that whether your message got across or not. So have an open communication. Take initiatives. and offer to help when and where you can. Of course, there is limitation because you are not a paid employee. You are a student for experience gain there. So we don't expect the students to do the job, but at the same time, we like to see that they are taking initiatives and they are trying to be hands-on practice. And learning by doing. This has always been my learning style, but everybody has their own learning style. So, all I can say is sometimes you can just watch, but if you don't do it by yourself, you're never going to feel the same confidence. So under supervision, try and do things yourself. And please keep well engaged. This is important because sometimes I really struggle when I see students are standing in the corner or hiding away, and there's maybe they're just not feel comfortable. They don't know the resident, they don't know the staff, and they just feel left out, or they feel like outsider. What I can say to you is try and take a step forward and even just sit down where conversations are happening and try to keep engaged. And by doing that, not only the resident, but your fellow colleagues or your buddies or preceptors, they'll also will see that you actually take trust. Yeah, you are entrusted, and then that way you can get better outcome out of your experience. Yeah. Next slide, please. One back. Thank you. So yeah, the last slide is about the opportunities, employment opportunities. So as I mentioned right in the beginning, there is staffing crisis, right? So we all know that, and especially locally. Yeah, skills shortage locally. We do see, since the borders open, we do see a number of overseas trained nurses are coming to New Zealand as level 4 caregivers, but we really want to see our local, students or taking, this opportunity to work as healthcare in a healthcare industry. Then again, as I said before, value for qualification. So definitely, if you haven't already, contact Leslie, right? And find out more about what is out there, what is available to you. There are different levels of qualification. So find out what you can do, and work experience. So as mentioned earlier, it is very important. Like we do get applications when the staff has not got any experience whatsoever, but they have qualification, of course, because they just done their level 3, 4, whatever. Emphasize when you write a CV, which is the next one, writing your CV, emphasize on the experience that you got when you did your work placement, and make it look genuine. Yeah. Talk about things that you learned while you had that work experience. And prepare ahead. When you're going for an interview or applying for a job, you prepare yourself, and CV writing is one of them. Yeah. So I mean, sometimes I just see a piece of paper really with the name, phone number, and just as qualification, and hardly anything about what experience they really got. And as I said, your placement experience is counted. So please emphasize on that. Yeah, get ready for an interview. Don't just you don't just walk into the place unprepared, because we do see those things, and look presentable. If I'm interviewing someone and they just walked in with the ripped jeans and in jandals, that tells me straight away that how much effort have you put into this. I mean, not judging anyone, but at the same time, we want to see people really coming to a place and like owning the job, and they are well interested, and they put an effort. So yeah, learn about the company that you're applying for, and what job you're applying for, what shifts are available that you're applying for, because half the time I interview staff, and then it's very clearly written in the ad that it's a night position, night caregiver, night wellness partner position, Tuesday to Saturday, whatever. And they come and interview. When I interview and ask their availability, they'll say, oh, I'm looking for Monday to Friday morning shifts. So that is a waste of time for yourself and also frustrating for the one who's going to interview you. So find out, yeah, when you get a call for an interview because you apply a job, find out what roster am I going to work. Yeah, there's no harm in finding that out and preparing yourself whether you would be entrusted to go ahead or not. Communication. So that's another one. When you having an interview, try to speak with your mouth open. So many times I see people like they get so scared, and I know interviews can be daunting and it's always nerve-wracking when you're talking to stranger. It is don't just mumble under your breath. Speak up. Yeah, nobody's gonna bite you. You just have your message across and speak clearly and maintain eye contact. And by that, we'll see that you are actually confident and you can actually communicate with the residents who are already with impaired hearing or they can't see you properly. And so we want to know that you would be able to communicate with our lovely residents. Be passionate and caring. Yeah. Authentic and genuine. Yeah. So when you talk with the passion. Like why aged care? I always ask this question: why aged care? We don't ask science related rocket science kind of questions. It's very basic, very general, day-to-day activities, what you do with the resident, how you look after, how you provide them care, how do you maintain the dignity, confidentiality kind of thing. So talk with experience, and be passionate about it. Own it. Yeah, own it. Last but not the least, as I said, maintain eye contact, remain confident, and don't forget to smile. That is very important because that tells me that you are confident and you are really keen for this job. So yeah, keep smile. Thank you. Over to you, Dr. Sadia. Thank you so much, everyone.
Thank you. Thank you very much, Nav. That was really good. Very, I would say amazing, awesome. All that information, though we have shared it many times with the students, but actually hearing it from someone who they can actually see later on sitting there as an interviewer or as their manager. I know that students, they definitely have made notes of all that. And especially for those who are interested to come and join healthcare, I think some very important and very encouraging kind of information which Nav has mentioned here. Thank you, Nav. I would like you to just have some water, and maybe before we will move to those question answers, I would ask Leslie to talk about our healthcare program. So in July, we would be having a lot of intakes, many cohorts coming in. So it would be good, Leslie, if you talk about those programs and those new cohorts which we would be starting soon. And then later on, we will start asking questions and we will invite Navneet again.
Thanks, Sadia, Dr. Sadia. So everybody, we do have some programs coming up. 3rd of July, we are starting our healthcare level 4 social and community services disability strand programs. So we have online timetable. So online just means you're doing all your study online 2 evenings a week, your sessions. The rest of your study is self-directed learning. And we also have blended learning timetable, which means that you will come onto campus 2-3 days a week and 1 day online. Blended learning just means on campus and online study. So it's a mixture. So we have those coming up on the 3rd of July at our Manukau campus and our Newland campus for blended learning, and of course online, Auckland and Waikato areas for now. We've got also our level 3 healthcare programs coming up on the 10th of July. Again, those blended learning and online timetables. 17th of July, we have some more coming up. 31st of July, we've got our level 7 diploma programs coming up. So we've got quite a few healthcare programs coming up right now. They are very, very popular. I must let you know that they are very popular. So if you are interested to enroll, then I would encourage you to contact me, because our healthcare programs are just so popular that they are full. They're full up. Everybody wants to enroll into our programs because they're flexible with your online learning. But if you prefer to come onto campus, have that face-to-face interaction with the tutor, then you have that choice as well. Okay, I won't go into all the details because there's a lot of information, but certainly if you've got any questions about anything, you can contact me. My contact details are in the chat. Thanks, Dr. Sadia.
Thank you, Leslie. Thank you very much. And just want to let everyone know that our programs are available for domestic students as well as for international students. And at the same time, just want to add that all our healthcare programs, they have work placement component where we place our students into healthcare facilities, and students, they do get that kind of work experience. And as Nav mentioned, you can add that work placement experience in your CV as well. And on the basis of that experience and knowledge, you would be able to be ready for your interview and later on for your job. So that's really great. Before students, they start asking questions, Nav, I have few questions. So one thing which you mentioned that about hoist and dementia level of care. So when students are doing level 2, level 3 program, would it be important for them to know all about hoist equipment and about dementia if they are? So how important is to know about hoist equipment and the training and how to handle it?
Yeah. So definitely, hoist is a very common equipment that we use in our hospital floors. No, it is not a requirement that all students must know how to use a hoist, because when they get the job, when they are hired, we provide, or every employer would provide them the training and competency for using the hoist, because that's the legal requirement. And same goes with dementia level of care. If a student is doing level 4, I would assume that they have better understanding of dementia because of the unit standards which are included in that. So they would be aware of how to manage a resident with how to de-escalate them, how to provide diversional therapy sort of thing. And if they are going to work in a care home where there is a secured dementia level of care, I would imagine that the management there would be providing them more than just an ordinary orientation. But yeah, we definitely would go for level 4 in that area. And hoist, as I said, no, it is not a requirement. I have come across many times when a student come to me and they applied for a job and they have never used an hoist. So that is not a negative point towards them. Yeah.
Yeah, that's good. Good to know now. But
Yeah.
we do provide hoist training to our students before they start their work placement. So we have a practical room set up at Newland campus where we provide that training, and we have all that equipment available. And at the same time, I would like to mention that very soon we would be starting our dementia micro-credential short courses for dementia. So those students, especially level 4 students who would be interested to work in dementia side, then they would be able to get enrolled into those dementia micro-credentials and would be able to cover that. As a manager, Nav, if you have an employee who has already completed level 2, how are you going to support that for more education or for higher qualification, like for level 3 or level 4?
Yeah, I mean, definitely. This is something I know every company has different policies around qualification support for the staff. Wherever I have worked, definitely we encourage all our staff to get qualification. However, we would want to see if a student or a staff member has done level 2, we would like to see them having a practice at work and working for a few months as that level 2 and basically just implement that knowledge into practice before they go to level 3. I am a career force assessor as well. So I have supported my staff who would like to do, level 3, 4, or whatever. So we definitely support our staff. Yeah.
Yep. Okay, that's good. Anyone from the students, if you have any question? Okay, so we do have some of the students. Paulina, would you please enable those students?
Yep. I am actually trying to find Janaya. I know that she is one of those. 1 second, please.
And I think
For some reason I can't find her, but I can. Marcela, I can. I am not able to do it from my end still, Sadia.
Okay,
Apologies
I can
for that.
do it. Marcela, you can unmute yourself and ask question.
There it is.
Thank you. So you were just discussing about the staff support, and I would like to know how would be the staff support for a student in level 7, and what are more possible placements for a level 7 student. Thank you.
So Marcela, are you asking from international students' perspective?
Yes.
Okay.
Thank you.
So those students who are on study visa are international students and they are completing level 7. So once they complete their work placement or once they complete the program, what are the job opportunities or how industry is going to support them? I think if Marcela, that's a question. Okay.
Yeah.
Yes.
Thank you for that. So I guess, again, it is different companies with their different policies around when it comes to the visa holders or students. We definitely had students, as Dr. Sadia mentioned, at my workplace who were studying as well as working part-time. And then later on, when they finished their course, they became full-time employees. So there is definitely there's employment opportunity, as long as there is job available, in the workplace. Yeah, so there is availability. Yeah.
So can these students, once they get the job, there can be a pathway to residency?
Dr. Sadia, that is, I think that might not be able to answer that question, because this is more of to an immigration point of view.
Yep,
yeah.
exactly.
So, and I'm not an immigration officer, so I don't want to say wrong.
No, I definitely understand that. Yes.
Yeah. So I'm not sure
but
how.
I do know that some of the providers, and especially if they are accredited employers,
yes,
then
I would say,
they do provide. Yeah.
Yes, definitely. So the company that we work in, that is definitely accredited. So if that was the case, yes, we do support them for visas with the immigration. Yeah.
Yeah. Okay. Thank you. Suzanne, you can unmute yourself and can ask your question.
Thank you, Dr. Sadia. Navneet, how about those students that have already done level 3, level 4, level 5, and working at the hospital at the same time, and are doing level 7? We have to go through working placement as well if we apply to your company?
I mean, I think that basically would be depending on what's the requirement of the study, I would say, Dr. Sadia. I mean, do they have to do how many certain number of hours to get that level? So yeah, I mean, they can definitely complete that level if they're allowed to in aged care. I mean, we don't mind having those students, in our facility. Yeah.
So Suzanne, definitely after completing your work placement hours, then yes, you can go into the job, whatever job you want to do. But yes, for completing the program, there is some requirement and there are some fixed hours which you would need to do, whether it's a level 4 or it's a level 7. Janea, you can actually unmute yourself and ask question.
Hi, I'm just wondering, so yeah, so I've been told there's a high demand for healthcare workers in New Zealand, but I was a bit confused because when I go on stuff like Seek and Trade Me, yes, there are jobs advertised, but not as much as what I would expect, considering there's a high demand for healthcare workers. Is that because companies prefer we apply directly to them, or what's the story there? That's a bit, yeah, I'm just curious about that. Do you guys prefer that we come directly to you, or do you prefer they advertise on places like Seek and Trade Me?
So, I mean, it really depends where the advertisement is on. If I have advertised for a role at Seek, I would be considering any applicant that comes there. I mean, again, I would not know which position and where it was advertised, but definitely if we advertise it with Seek or Trade Me, wherever, we do consider all those applicants. But where are you joining from, if I may ask you, Janaya?
I'm in Auckland, but like, for example, if I was to go on, say, Trade Me and look under healthcare, it comes up with the different companies, the positions available. So all I'm saying is that there's not as many jobs that is on Trade Me that I would expect, considering there's such a high demand for healthcare workers. So I'm just wondering, is it because the companies prefer that we apply directly, or yeah, what's the story with that?
Yeah, so
there are jobs, but not as much as what I would expect.
Yeah. I think you just maybe need to widen up the radar a little bit, because big companies would have their own HR processes. They would be advertising for job vacancies maybe on their website. Not everybody goes on Seek and Trade Me because there is cost involved, of course, to advertise for a role. So do check on their websites. Definitely they'll have advertised there as well. Yeah. But again, dropping a CV, that's another one. If there's a local care home nearby, just drop a CV, because you never know. Half the time we just out of blue we get the CV all of a sudden, and here we go, hallelujah, go for it. Yeah.
Thank you, Janaya. Thank you. It was really a very nice question. Bessie Ocon, please ask your question. You can unmute yourself and ask the question. Yeah, Bessie, are you there? You can unmute yourself. Okay, Bessie, if you are having any issue, any problem, then you can type your question in the chat. And in the meantime, we can ask Susan, who has raised her hand again, and she is ready to ask another question.
Thank you, Dr. Sadia. How much do you offer the rate after level 7?
I think it just goes according to pay parity. If you are aware of the pay parity rates, and correct me if I'm wrong, Dr. Sadia, the level 7 is equivalent to level 4, unfortunately. And that's according to the New Zealand pay parity, which came in action in 2016, 18, some time ago. Yeah.
So it's 28, 25?
I'll have to check because it was recently reviewed. So yeah, I can see Dr. Sadia nodding. So yes, that would be it. Yeah, and we definitely pay the same rate as per the pay parity. Yeah.
Thank you.
So thank you, Nav. Just want to confirm that yes, our level 7 qualification, it is equivalent to level 4 pay parity. According to Ministry of Health, you can actually see the equivalence on their website as well. And level 4 is the highest pay parity. So after completing level 7, yes, you would be able to get the highest one. And yes, it is 28.25. Okay, Hartaj Singh. Hartaj, you can unmute yourself and ask your question.
Good evening, Dr. Sadia and Navneet ma'am. So my question is, like, because I am an international student and I'm doing level 7 in NZSE Newland campus, and like because my study is gonna finish in September, and my visa is gonna expire within 1 month after my study finish. So what are the possibilities that I can apply for a full-time job before my study is gonna finish, because it's gonna be only a 1 month period after my study finish to apply for any visa process, and it's gonna take time too. So because even if I'm asking, like recently I have asked many places and they are like saying because it's too early to guarantee me any full-time job at the moment. But if I wait for completion of my studies, I think it's gonna be like very much hassle for me, and with that much less time. So what we can do for that?
So Hartaj, are you currently working even as a part-time?
Yes, I'm currently working
As part-time, yeah?
part-time.
Yes, so I mean that's what I was gonna say, to start somewhere as a part-time, and so at least you gain the qualification and as well as the experience at the same time, and I think it's just a matter of having an open and honest conversation with your employer, with your manager, and tell them that you're very much interested, you're finishing your study in this month, and if there would be, because we see a lot of changes in the in our employees in a month or so. So if they know you are interested and from this time you are waiting to get your qualification and ready to be full time, I mean, and if as long as they got a job and you're already working there as part time, so which is in your favor, that's the only advice I can give you, because at the moment, of course, you're right, they can't offer you full time because you're on student visa, I believe.
Yes.
So yeah, it is a bit tricky one. But I think if you have that discussion with your employer, and they should know that you are interested in full time and you're available from this month, and hopefully that works out for you, because I think there's no other better answer for that. So I'm afraid.
Because where I am working, they have like a clear-cut answer to my question that at the moment there is no full-time opportunity, and even in the coming time, everyone if I have applied to the other places, and they are also like not sure if there's gonna be any opportunity in the coming time. And so is there any way, like if I can get a letter from my college to like describing that I'm gonna finish my study like in that specific time, like as a guarantee that I'm gonna finish my level 7, so that I can get a job?
Hartaj, the thing is that when we provide the offer letter
Yeah.
at the start of the program, all the students, they have that letter to show that yes, they are enrolled into this level 7 program or any other program, and when this is starting and when it's going to finish, and you can actually show that to let any employer know that yes, you are currently studying this particular program and it is going to finish on this date. In your case, I can see that it's a bit hard luck, but otherwise a lot of our level 7 students, they are able to get jobs by this time, and they are able to get that kind of agreement that once they will complete the program, then the employer would be ready to offer them a full-time job and would be ready to support them. For you, I would say that the same thing which Nav actually advised earlier, that increase your horizon, start looking for other job opportunities as well, start looking for jobs outside Auckland as well. Build your CV in a way that it becomes attractive for the employers. If you have received no from few of the employers, then just don't get disheartened. You need to look for more and better opportunities.
Okay, thank you, ma'am.
Thank you. Just I know a lot of students have raised hands, but we have some questions in the chat as well. Bessie has mentioned that I'm an international applicant hoping to join the level 7 course in October, allowed to work part-time while studying. Do you have students accommodation for international students? We don't have an accommodation, but we do help the students, international students, in finding accommodation. We have student support who do help the international students. And yes, once you are on study visa, you can work part-time. Hima Jani, she has mentioned, hi Nav, if I have experience in recruitment field for 15 years, do I still need to get job as healthcare worker and then proceed?
Sorry, I couldn't understand. Proceed as, what's the question?
Hima, do you want to change your job from recruitment to healthcare? If you have 15 years of experience in recruitment field and now you want to move to healthcare, then this means that you are going to start healthcare work from zero. So
From
obviously
scratch.
that 15 years experience might not be considered, but yes, all that skill and knowledge would be helpful for you to grow quickly and move further very quickly. One of the participant has asked for Navneet email to share about my study plan. Navneet, again, it's totally up to you whether you want to share any email or if they want to contact you separately, then how it's gonna work.
I mean, are they your student, Dr. Sadia?
I think one of the,
Yes,
not our friend. Yeah.
No, yeah. So if they contact you guys, and then you can pass it on to me, and I will be happy to respond.
So Siddharth, you have Leslie's email address. So, and I can share my email address as well. So you can actually send an email to us, and you can talk about your study plan and what your questions are, and we will help you to get connected with Navneet. Pratika has a very good question. How does the organization support the well-being and professional development of healthcare assistants?
Yeah, that is a good one. Definitely, apart from your qualification that you gain level 2, 3, 4, 7, as an employee, when you work in aged care, we as employers are there to support you, and there are a number of trainings that we would provide you each month. Some would be practical, some would be theoretical. Such as the basic things that you need to know for your job, and sometimes it will be a refresher course, and sometimes it would be to expand your knowledge and skills, such as first aid training, for example, if you are working on a night shift or an afternoon shift, when we have less number of staff, then yes, you have that opportunity as well. But apart from that, we provide our staff on number of training, such as managing residents with behaviors that challenge dementia care, or whether it's mobility, moving and handling. Yeah, so there are a number of trainings that we provide under the ARC contract.
Yep. Thank you, Nav. Thank you very much. Vijay has raised her hand, one of our tutor, a very experienced tutor. Vijay, you can unmute yourself and you can ask questions.
Thank you, Nev, for coming and taking our invitation. It was wonderful to hear you. I wanted to just answer Hartaj Singh's question, Sadia, that he wanted a job and he's not getting offer. We had one industry advisory meeting today, and one of the managers said Hawke's Bay area is looking for staff. So if you want to go outside Auckland, and you know that immigration gives plus point, I think you get 50 or 30 points outside Auckland. So please apply in Hawke's Bay, rural areas of New Zealand. 100% if you are international students, you will get. And those who are disability students who want to join disability strand, we are working with Spectrum. Sadia and myself, we are working with Spectrum Care. So there will be opportunities for disability students to work in Spectrum Care as well. They will pick and choose, but there is opportunity. And I know Navneet will agree with me that if any rest home has YDP contracts, disability 10 beds contracted, even after you've finished your disability strand, you can also work in aged care, but they should have the YDP contract.
Yep.
Thank you.
Thank you, Vijay. Yes, thank you for reminding. Yes, that was actually a very good answer. And I hope that it would be helpful for Hartaj and for other participants as well. Bessie, for your question, I would like you to contact Leslie or our international recruitment team. They would be able to provide you all the details about the tuition fee, about the enrollment fees, and about fee discount and installments, everything. So we do provide installments, we do provide discount as well. But again, you can get all that information from our recruitment team. Any other question? Anyone else who wants to ask the questions from our Nav, though it is already 8 p.m.? Okay, so Pratika has one last question. How does your organization handle feedback or suggestions from healthcare assistants regarding process improvement or patient care? Yes, again, a very good question, Pratika.
Yes, I mean, we always welcome that. You know what I say, the staff or the healthcare worker, caregivers, they are the eyes and ears on the floor, because we as manager can't be everywhere. So if we get any feedback or suggestion, I would be happy to get that. And I know sometimes it might be a tricky one. You know, as much as we would love to, we just can't change things sometimes. But again, working together, I think that is the main important thing. And as long as our goal is the resident care, we definitely would be interested to find out, you know, what suggestions you might have.
Yeah. Priyanka has a question as well. Can you share differences between medication competency and management?
Yes, so thank you, Priyanka. It is a very good question, because as I was saying lately, we had a number of staff shortages and nurses shortages. It is not a news to anyone. And you would have heard from your students or, you know, from the industry that we, as in healthcare providers, as in aged care providers, we had to use our level 4 and still are using level 4 as our medication competent senior caregivers, team leaders, senior wellness partners, whatever you name it. So basically, the level 4s, because they come with a more understanding and knowledge, if not just experience, in the industry. So we have utilized that knowledge and skill, and we have trained our staff to be medication competent. Definitely, there's going to be one RN at least on the floor, on the premises, even if it's just me. So being a nurse with the license, that means that I will be working with my senior caregivers or wellness partners who are running the team, running the show pretty much, and that includes medication. But there are limitations when it comes to medication, such as controlled drugs, insulin, or you know, special medications such as warfarin and whatnot. So we don't expect our level 4s to do those on them, or you know, by themselves. So as a nurse, we would be there with them. But doing medication rounds, there's competency. Every company has it, their own competencies that we train the staff. We give them opportunity to learn hands-on, practice medication rounds few times with the nurses before they get competent, and then they are able to do the medication rounds. Yeah.
Okay. Yep. Thank you. Thank you very much. Now, Simar, for you, we normally do provide all these certificates, the completion certificates, before students' visa expires. And it doesn't matter whether it is in December or January. It doesn't matter in what month of the year. And there would be enough time for you to apply for your work visa or post-study visa. So Priyanka has asked, I think, related to the same question which she asked earlier. So level 4 has to undergo a special training. So how can they apply for that? If they want to have that medication competency or any special, we do have level 4 students. And if we place them at in a facility for the experience, would your registered nurses would be available to provide that training? Or if someone wants to have that training, then how they can approach?
Yeah, I mean, like as a student, you're saying, not as an employee.
No,
Yeah,
as a student.
As a student, yeah. So we have not faced that so far, but again, you know, there would be limitations around that, Priyanka, as simply as because they're not paid employees. So I would say definitely we can provide them training, we can guide them, support them. What we might not be able to allow them, we definitely wouldn't be able to allow them to do medication on their own. But definitely they can be buddied with. And I know from experience that level 4, when they do, there used to be a paper. I haven't marked papers for a very long time now. That was around medication. So the student would have to go around medication rounds with the nurse while they do medication. But of course, they're not deemed competent just because they are students. Yeah, so we would be able to provide that. Yeah.
Okay. I think Janea, she has raised her hand again. Janea, you have another question?
Hi, yeah, thank you. So I'm curious, how important is it to have a reference? And I ask that question because, say, for example, we have our qualification, level 3, 4, 7, whatever it is. And so, you know, you've worked before and your past employers have left. So you can't, you know, and you don't know where they've gone. How important is it to have a reference, or, you know, how would we go about answering that?
Yeah.
You know, when it's out of our control.
Yes, it is out of your control, but at the same time, you're very blessed to have your lovely tutors who know you when you're doing your placements. And they do get feedback from whether it's clinical manager or the care home manager or the nurses that supervise you while you do your placement. So I have considered in my experience when the staff apply, and yes, some of them have never worked as a paid employee in their life because they just came after higher studies, you know, secondary school, and came and did the level 3, 4, whatever. So they have never worked, so they do not have any references to give. So we would contact their tutors and find out basically we just want to know, you know, like how, what to expect. You know, what support would you need? What's the best way to deal if there's any issue? And also at the same time, how much responsible the staff are. Like, and we would know from your tutor if you have completed all your assignments and, you know, you were on time to class or for placement. So yeah, your tutors would be, and I mean, as long as they don't mind, can be your referees. Yeah.
Thank you.
Thank you, Janea. Thank you for another good question. Vijay, just being conscious of the time, you have just 30 seconds.
Yes, I just wanted to add with Navneet about the medication competency, because Navneet, not all facilities, when their students allowed them to do medication competency, some facilities, for example, CHD, you have to be permanently employed staff, then they will do medication competency. But some companies are very flexible about that. So it depends where the students go for attachment and what the policies are of the company. Thank you, Navneet.
Thank you.
Thank you. Thank you, Vijay. And Siddharth, it doesn't matter if you have done business studies, you are still eligible to get enrolled into our level 7 program. And please do get in touch with Leslie. She would be able to provide all the information, including the entry criteria. Okay, it's really good to know that you are interested to get enrolled into our level 7 program. Thank you very much. Thank you, team. And we will finish now. I think this is the time to end our meeting. And again, I would finish it with Karakia. Anuhia kiti uru wapunoi kia vatea kia mama ti nagakao tin tinana ti vairua ai ti ara takata. Kaiura e rango whaka iria ake ki runga. Kia tina hoye tai kie. My Maori pronunciation is not so good. I'm still learning, but thank you very much for all of you for joining. It was really great. Such nice questions, and enough from your experience and from your all that vast knowledge, the answers which you have provided. I hope that it would be very helpful to all the participants. And thank you very much. Have a very nice evening. We'll see you again next time in another webinar. Thank you.
Thank you.
Thank you very much.
Thank you.
Thank you.